When should a patient with IPF be considered for a transplant referral? This is kind of an easy one. They should be considered for transplant referral at the time of diagnosis for the very reason of acute exacerbations. Acute exacerbations can happen in patients who are asymptomatic, who are, have normal levels of lung function. And usually this is something that is recommended because we want to put the safety net of a transplant evaluation in place in case the patient has a sudden deterioration related to an acute exacerbation. We talk about a window of opportunity for transplant, for placing patients on the transplant list. We don't want to put them on the list when they're too early and not sick enough, and we don't want to wait until they're too sick to warrant transplantation. The back end of this window admittedly has kind of grown through the years, where we will now transplant patients on mechanical ventilation and take patients off ECMO and transplant them as well. Sometimes patients with IPF can whiz through this window quite quickly, especially if they're in the process of having acute exacerbation. Hence, once again, the need for early referral for a transplant evaluation. Transplant evaluation doesn't necessarily mean the patient will be placed on the list right away, but should they have an acute exacerbation, it makes it much easier to put them on the list more expeditiously and try and salvage them with a lung transplant. So once again, the timing of referral is at the time of diagnosis. Timing of listing takes a discussion between the patient and their transplant pulmonologist. But here are some guidelines. If the patient has deterioration, a 10% drop in their FVC, a significant drop in the DL, if they have increasing oxygen needs, if they're hospitalized, these might all be reasons to go ahead and proceed with listing them for lung transplantation.